By thanking DPH for inviting CCamp and giving this platform to share some of the work that we are doing. Also, congratulations. The 100 number stands probably apart. Definitely, it's a trailblazer as you have written it truly. So on both counts, I thank and congratulate you. Um, my topic that has been given to me is innovative technologies improving public health systems. I have taken liberty to put the word public within that title. And I the innovative technologies that are improving the public health system, and the fourth one are opportunities and challenges that we have. Um, Center for Cellular and Molecular Platforms, CCAMP. Um, uh, we are an initiative of Department of Biotechnology, Government of India. Um, we are also a part of larger Bangalore Life Science cluster on the same campus, which includes National Center for Biological Sciences, Institute for Stem Cell Biology and Regenerative Medicine, and Tata Institute for Genetics and Society. Together we form Bangalore Life Science Cluster, and probably we are one of the largest life science innovation and research hub in the country. Our mandate is to enable cutting edge life science research and innovation and bridge the gap between academia and industry. I think we are almost 14 years old, and as every organization evolves, I think we have evolved a few steps beyond that, and I will speak a little more about that. CCAMP enables technology innovation for impact. My two previous speakers have really formed a well set platform in terms of talking about technology innovation. Um, uh, the way CCAMP looks at the innovation is we look at facilitating research, we look at developing technologies, and then we look at nurturing innovations. It's a long stage. It's more than almost, I would say, depending upon what field you are working in. It ranges from 3 to 10 years, and therefore it's a very long stage phase. It requires a lot of resource, lot of efforts, lot of energy that needs to go behind it. And our ultimate objective is to deliver societal impact. Health is a key impact area in that, and that is something that I'm going to talk about in today's talk. Outcomes over the last 14 years, CCAMP has enabled and impacted the society by enabling deep science innovations in the complete broad spectrum of life science areas. And when I say life science broadly, we can talk about health, agriculture, and environment. But in this, on this platform, I'll talk about health. And within health, we are talking about the drug development to the regenerative medicine, to medical devices, to digital health, and so on. Uh, you can see that there are specific thematic areas that range from antimicrobial resistance, molecular technologies, regenerative medicine, infectious diseases, oncology, maternal and child health, NCDs, medtech, and so on. This resonates quite well with some of the focus areas, specific focus areas that you may have within the DPH. We have now supported more than 370, I would say we are almost touching 400 innovations now. These are deep science innovations. It has taken a time for them to reach the fruition. Some of them are still in the making stage, but these are the technologies that you invest in. And when I say invest in, it is not just about money, it is also about the resources, time, people, and so on. These are some of the innovations that are really going to help you when a sudden and completely unforeseeable disaster like COVID-19 pandemic hits. We'll talk about that little later, but I just wanted to know that deep science many times gets a little lost. It has probably been diluted also on different platforms, that terminology. But here what we are really talking about is research-driven kind of product development, technology development that is happening and that we are looking at. So this is about CCAMP and what we do, what we are. I'm going to talk a little bit about the context from which we feel and we drive enabling the innovations. We are looking here at 3 lines of 3 lines to realize universal healthcare as is espoused by World Health Organization, WHO. The first axis, as you can see, is population axis, who is covered, and there we have challenges. We have billion plus population, we have a geography that stretches for thousands of kilometers, and the terrains that range from extremely hard to a kind of highly dense population areas. So that is our challenge. The second one is the service axis, which is services that we need to provide. And here we require the skilled workforce. And we, of course, we know that the situation where we are when we look at the skilled workforce. The third axis that we are looking at is the cost axis. We have extremely tight cost constraints. And these are primarily our challenges and the constraints that drive our innovation enablement. So how do we convert those specific challenges into the requirements that are built into the innovations that we are making? Affordability, accessibility, availability is something that the previous speaker spoke about, which in turn should ensure that there is a quality at scalability. So those are the 2 main focus areas that we look at, and therefore if we look at and if we achieve those objectives, those features, if we build those features within our innovations, I think we would be able to achieve equity and universal health coverage. So that is essentially is the base platform that drives our motivation, that drives our activities at CCAMP when we develop the innovations. Now, probably the previous question when I asked the speaker, I'm just trying to give the context here that CCAMP works across all the 5 kind of pillars that take the innovation to the impact. It ranges from ideas require giving funding, and CCAM provides funding. We help in research and development. All of us we come from science and technology background, and in that sense we probably are little a kind of a separate group out here which is focusing on technology, which specializes in technology and representing and presenting on the public health platform. The third one is prototyping and scale up. Fourth one is testing and regulatory. Now, these are the four stages where you require a good amount of funding, good amount of mentoring, hand-holding, good amount of resources to build these prototypes and so on, etc., as well as good amount of domain expertise to build the products. Now, with this, we have the products ready. At the end of the fourth arrow here, you can see that these are the regulatory approved technologies, and which means that they are ready to go into the health system. Public health is the largest, I would say, the uptaker, the consumer of these technologies. Question is that how do we enter into that final lap, which is the field deployment? And that is where my whole rest of the presentation is going to be concentrated about. The reason we speak, I'm speaking on this platform is also to find that commonality between the public health and the innovation development. So taking innovations to society requires a highly interdisciplinary effort, highly consultative as well as highly participative approach, wherein the technology, the development community, innovation community works with the public health system and the health system at large. We started this effort during the we were pushed into this effort, let me put it this way. We were pushed into this effort during the COVID-19 pandemic, when many of our innovative technologies which were trying to enter into the public health system were actually invited from the other end that please provide us support, we require support, and that is where we started taking our innovations to the field, to the public health system, and collaborating closely with the public health system. Today, during COVID-19 times, we put almost 8 of our innovations in 18 plus states. Of course, this was possible only because of the support from large number of partners. But the bottom line here is that COVID-19 taught us that we, the innovation community, we are not really confined to the laboratories. We need to enter into the public health system, and we have to take the innovations all the way through to the public health systems to generate the initial evidence and then give it to the public health system. I will go a little faster here. So I'm going to give a quick showcase of the technologies impacting public health, some of the efforts that CCAMP has been doing. The first technology I would like to talk about is extending respiratory support for newborns and pediatric population in Assam. This is the technology which provides non-invasive CPAP and HFNC respiratory support to the neonates and newborns. This is the effort that we have been able to support and take it in the complete state of Assam, all 33 districts, 307 facilities, and we have over the last 1 year, we have been running and generating the data at the health system level, public health system level, and which is showing significant improvement in the outcomes that the public health system is looking for. The second effort I'm going to talk to you about is saving nursing hours and strengthening public hospitals with critical care technology. This is a technology which is a contactless ballistocardiography based technology which does remote patient monitoring. One of the important aspect of it is that because of the contactless nature of it, what we can do is that this can actually be used in some of the very important places like the highly contagious disease confinement and management, as well as high dependency units where you can look at little bit of a step down critical care if the complete ICU beds and critical care is flooded with the existing requirement. We have deployed this system across 9 states, 11 hospitals, and we have been able to show in our evidence that it saves 69,000 plus nursing hours over the period that we had used. So these are some of the early kind of stages of the examples and the technologies that I would like to introduce. Just the last technology I wanted to introduce. I also want, I'm seeing here that I'm running tight on time here. Just one specific technology I would like to introduce also is improving last mile healthcare for routine immunization and COVID-19 vaccination in Assam and Manipur, as well as we have also done that in Tamil Nadu in 6 districts, including difficult geographies like Nilgiris. And it has been able to show that because of the active nature of the technology, active portable battery operated vaccine carrier, as opposed to the ICE use blue boxes, I think this has been able to show a good amount of adaptability and uptake and acceptance from the public health system. So these are the kind of efforts that we are building. We are trying to also do it evidence-based way so that the public health system is convinced. By no means these are the only efforts. We have multiple technologies, at least I would say 30 to 40 technologies that are ready to be kind of taken to the public health system that ranges from MNCH, maternal, newborn, child health, non-communicable diseases, tuberculosis, eye care, mental health, and digital continuum, which essentially forms the digital backbone for the most of the programs that we would see that eventually in the ABDM era that we will roll out. I'll probably last couple of slides. Just wanted to highlight here, if you look at this as a strategic point where technology community, innovation community is a magnet and the public health system is essentially what we are trying to attract. This is not going to happen in silo on our own. The identification of requirements and the uptake of the technology has to be heavily partnered with the public health system, and only if that magnet is strong, we will be able to create the public health system impact. So I think my point here is very clear that the innovation community is ready with a set of technologies that can be taken to the public health system. that goes across the thematic focus areas, and we require a strong partnership with the public health system that we would kind of require to realize the real potential of these innovative technologies. Just a quick snapshot. I think Dr. Selva Vinayagam probably would remember DPH and his team, Dr. Vinay and the team members visited CCAMP a few months ago. And we are really looking forward to building on those efforts as well as our ongoing efforts in Tamil Nadu to build a strong synergistic partnership with the state of Tamil Nadu. So I think with that, let me stop here in the interest of time. I have little rush through my few slides, but I think we don't want our dinner at 11 o'clock. So I think I will stop here, but happy to take questions now, offline or even over the emails, whichever way it is. Thank you.
Thank you, sir. Thank you for giving an outline on some impactful innovations from CCAMP. And you also said about importance of having UHC as a context for innovation. Now the house is open for questions. Any questions?
Thanks, Niranjan, for insights, like amazing amount of innovations from CCAMP. Just wanted to ask you about, like, how do you, what's your prognosis on when digital health is going to be mainstreamed for public health? What is your prognosis on that, and how do you think ABDM fits into that?
So from the ABDM point, which essentially mostly about creating the standardized framework, I think that I would say levers have started moving. From the system side, I think you have more knowledgeable and more, I would say, better decisive people here sitting here. They would have to speak from the system side. I think I know that the innovation that Mediotech has been working on, you have been working on for many years. Since COVID-19 pandemic, we are also working together. I think there are many innovations really rearing in the, I would say, wings to go forward. ABDM side, I don't see much of a problem coming from the standards and the framework side, but from the public health system rolling outside, I think it will happen in a phase-by-phase manner, as is what it should be. How fast, when, really depends upon the different states. Health is a state subject. We have seen extremely eager and kind of set of states that have started working in this direction, and Tamil Nadu being the trailblazer, I hope that this will be one of the very important cornerstones. I also hope that this will be the cornerstones within the public health system, not just in a larger, in the preventative as well as social health system, not just only in the in our tertiary care and secondary care system.
Thank you. Any more questions?
Now I kindly request Additional Director of Public Health and Preventive Medicine, Dr. Seren sir, to honor the speaker.